you. Thank you, Cleo, again for inviting me to this wonderful symposium to share some of our recent research. My name is Shan Jiang. I'm an assistant professor at Tufts, Department of Urban and Environmental Policy and Planning. So I'm a planner by training, and it's great to hear many geographers, GS scientists to share your research on POIs. And today I want to share from a planner's perspective how POI can be helpful for planning purposes. So the topic of my talk today is the geography of just accessibility in the US. I noticed that the title is not correctly listed on the program, but I want to focus on this concept of just accessibility. I want to acknowledge that this research work is a collaboration between research teams. The research lead is a PhD student who was a visiting student at Tufts from Peking University, working with Professor Yu Liu, Jian Wang. He recently successfully defended his thesis. And also my students from Tufts, undergrad, and also my colleague, Professor Julian Edgerman, who also provided the theoretical framework of justice sustainability. So we have developed an online web-based application that I put the link here. You can click and explore. It's justaccessibility.herokuapp.com. So basically, the idea is to use POI to help us understand the key important concept that is accessibility. So accessibility is the ease with which residents may reach the potential opportunities and services available to them by various transportation means. And it can be measured by different approaches. For example, the most frequently used approach is the gravity-based form listed below to measure the cumulative opportunities that can be reached from a given location by existing transportation networks. And it is an important concept to understand social progress in sustainability. As we all experienced this in the past year, the changes in mobility and accessibility to essential services due to various measures in social distancing, business closures, and reduced public transport services during COVID-19, as many of our speakers mentioned. So these are just news reports and images that we've seen that people are waiting in longer lines because of the measures of social distancing and waiting more time for their daily essential service activities, like going to grocery stores, food stores, and also going to healthcare destinations. Here we propose a concept that is called just accessibility. So the idea is to measure accessibility, but in a just and equitable manner, regardless of individuals' social, economic, and ethnic and racial profile. So we use this as a critical lens to examine the inequity of communities with different socioeconomic characteristics to essential services across top US metropolitan areas and before and during the COVID-19 pandemic. And we want to measure the changes of accessibility for these different destinations, essential services among the different social, ethnic, and racial profiles. So we ask how the social distancing, business closures, and delays of public transport services have impacted communities' ranking of accessibility to destinations of food, grocery, and healthcare services. So you can explore this website. Basically, we collected data for these top 25 US metropolitan areas, and we explore the various measures. So for example, for social distancing measure, we introduced a competition for accessibility with competition. So normally you will see the gravity-based accessibility measure. It's only a measure of cumulative opportunity. But now, because people have to wait in the line, they have to keep 6 feet apart. So we introduced the competition effect. So the data, the point of interest data that we use, we crawled the Yelp API for the 25 top US metropolitan areas. Yelp data is open data, and it has business location information, category, and operation hours. So as I mentioned, we compare before and after the COVID, not after, before and during the COVID event. So we crawled the May 2020 POIs for these 25 hours and 25 cities, and then we found there is information about whether the operation hours is open or closed. So we will know whether the POIs are closed because of the shutdown of the different measures and policies. And then we also include road network and public transit information from also open source data, including OpenStreetMap, as well as Transitland platform, which include public transit schedules for all these metropolitan areas. And also we include the American Community Survey data for social economic variables to measure, for example, racial profile and also income level for these various communities. So after we compute the accessibility for these metropolitan areas for different categories of destinations under different scenarios, so we develop different scenarios, for example, with only social distancing measure, or combining social distancing with business closure, or have these three alternatives together with public transit delays, because we all know that because of the COVID, public transit services have much lower level of service. They have delays due to the headway, longer headway, and also social distancing measures. So this is an example of the ranking of the top 25 metropolitan areas studied here. So the top line showed the comparison of Black population and white population before COVID-19. And the bottom line is after or during the COVID-19, when we introduced the social distancing, business closure, and public transit delay measures. So for example, I want to show you, so in this application, you can explore specific metropolitan area. For example, this is Washington, D.C. area. So you can choose the scenario of the policy that I mentioned, and also the categories of destinations based on the POI types. And then, for example, if you're interested in to see the decrease areas in terms of accessibility, by on the left-hand side is the Black communities, and on the right-hand side is the white communities. You can see clearly the pattern. For example, for DC area, for the Washington DC area, you can see for Black community, for decrease, we have poor community decrease as well as non-poor community decrease, a large area for the Black communities. But if you look at the white communities, the decrease area is not that many. So this is at the census tract level. So if we look at the increase, so I want to highlight when we are talking about increase and decrease, that this is not absolute value of accessibility. This is the ranking of accessibility, because we all know that people experience delays during COVID-19. But when we rank the communities based on their value, we want to compare the ranking of these communities. And you can see that the ranking, this is basically saying the ranking of the white communities during COVID-19, they're increasing for either poor white communities or non-poor white communities. And when we compare these ranking indices among these Black poor, Black non-poor, white poor, and white non-poor communities, you can see clearly disparities between the Black communities and the white communities. So the income level is not a key factor, but racial and ethnicity is a key factor that we see the disparities. And I want to highlight that these communities are within the 10 kilometer from the city center. Again, this is another example for Chicago metropolitan area. And on the left-hand side, you see decrease for Black community. And on the right-hand side, you see decrease for white community. They're focused, they're concentrated in the city of Chicago. But if we look at the increase, majority of the increase for this tract level community for the white is in the suburbs. When you compare these indices, you see similar trends. Black poor and non-poor much lower than white poor and white non-poor. And this is similar trend in New York metropolitan area. Black community decrease. And for New York City, you see for white community, also they have significant decrease in terms of accessibility because it's in the dense urban area. When we introduce this competition, in fact, because of the social distancing, the city residents are suffering much more than the suburban residents. You can see here, again, for increase, the Black communities have relatively limited number of increase. But for white communities, you see a wider range of white communities have increase of accessibility ranking. And from this comparison, it seems like New York metropolitan area is more equitable compared to their counterparts like DC and Chicago. So if you recall the ranking that I showed you, so for those on top of the list, we see a clear disparity between these racial community differences. This is Detroit. You can see clearly a pattern for suburban area. They experience relatively increase in terms of accessibility. Again, this is when we look at the summary, the Black community actually suffers more than the white community. And this is the figure for the whole US. And if you look at this map, it's interesting that for many of the metropolitan areas in the East Coast, the gap between Black and white is relatively larger compared to their counterparts on the West Coast. So the top line is during the COVID-19 and the bottom line is before the COVID-19. So even though the disparity exists before COVID-19, but the gap is increasing during this challenging time. And this is another summary of the accessibility index change in terms of the spatial distribution from the city center to the suburban area. As we move away from the city center, we see a relatively increase of accessibility ranking for all the cities. As we can imagine, because in the suburban area, the density is much lower and the competition pressure to reach the destinations are relatively lower, while in the city center you have a more dense distribution of population but a limited number of POIs for the essential services. So we can see that. So our analysis revealed that racial disparities in accessibility to essential services before and during the pandemic exist, and also inconvenient truth that the racial gap has increased across many US cities during COVID-19. So we actually call for actions to close the gap in just accessibility. So as I think many of the presenters mentioned, the data of POI actually is very it's key to measure accessibility. For transportation planners, many of the time we talk a lot about mobility, but the key to the social welfare is actually the services which are measured by POIs. So I think that the symposium is important because it provides the framework and data for planners and policymakers to look at these social issues that needs attention. Thank you. That's all my presentation.